welcome to another episode of Inspiring Series. And today we have a special guest with us. It's Datuk Dr. Kuljit Singh, the President of Association of Private Hospitals in Malaysia. Hi Datuk, how are you?
Hello, how are you?
I'm good. I'm good. How are you?
I'm very good, fantastic. Thank you.
Yes, and how are you doing this PKPP?
Well, things are slowly getting back to normal. We had a very quiet 2 months, even in the health sector, particularly in the private healthcare sector. But things are slowly going back to normal. Patients are getting used to the new norms. And I must say that looking at the crowd on the road, hopefully they're keeping themselves safe with good safety, following good SOP. I can look, the future is going to be good.
Yes, so we are in the recovery stage, yeah, Datuk?
Yes, right.
Okay, and first and foremost, I would like to thank you for being in my show, Inspiring Series. And can you tell us more about yourself, Datuk?
All right, thank you. I'm actually a practicing doctor. I specialize in ear, nose, and throat. I still practice. I still see patients. Besides that, I'm the medical director of Prince Court Medical Center. And with virtue of being the medical director, I also got elected as the president of the Association of Private Hospitals, Malaysia. So with these portfolios, I keep myself pretty busy in enhancing good practice among the private hospitals. And at the same time, private hospitals do contribute quite a bit to the healthcare of the country. We take away a lot of burden from the public sector. So those who can afford private healthcare, we actually look after that particular segment. And it has been very interesting in the last couple of years, looking at the private healthcare sector, which included the emerging medical tourism in Malaysia. Of course, with the COVID, there are a little bit of setbacks, but I think we will recover.
Yes, so you mentioned MHTC. Yes, Malaysian Health Tourism Council. So I remember last year in October, I was the Masters of Ceremony. I was the MC for the MHTC event at the Majestic Hotel Kuala Lumpur. So yeah, there's so many plans for medical tourism, for tourism in Malaysia for 2020. But unfortunately, due to COVID-19, so everything has been postponed, with our tourism, hotel, everything. So hopefully after PKPP, we can slowly recover and our economy can slowly, go up, slowly but surely after, PKPP. Yeah.
Yes, hopefully.
Yes. Okay. And for the next question, due to COVID-19, a lot of people are depressed and a lot of people lost their job due to COVID-19. So many companies are downsizing. How can people develop a growth mindset, build resilience, and bounce back through difficult and trying times?
Well, first and foremost, this kind of situation, I don't think anyone has been prepared for. No. In my lifetime, I'm half century old, and we have not come across a situation of this nature.
Exactly, and nobody is prepared. Yeah.
Correct. There were a lot of economic downturns, but nothing of this sort, where everything went to really zero for some industries. So I don't think anyone has been prepared, even the big players, small players, SMEs, individual, were not prepared for this. And I think because it is pretty global, it is across the board, not just in all industries, it is multi-nations, not just in Malaysia, in every other part of the world.
I think it's the whole world. Yeah.
Whole world. So looking at that aspect, it is not that bad, because if you are the only one suffering, then mentally you will feel terrible because everyone is doing well except you. But in this case, it's across the board. and every industry. So there's no one can be better than you. So in that sense, if you look at it mentally in that angle, it will be a little bit more refreshing because everyone is about the same level. Where you stopped and that's where you are. Yes, there are jobs that you might not have, but I think we need to get out of the comfort zone that we always had, that, you know, we always took it for granted. That things are always there for us, and this is something was very much unexpected. Never say die, because we definitely have a lot of options and talents in us, and this is the time that you can actually look back and see what talents that you have in yourself, that you can actually bring the talent up in order to bring up yourself back to feet. It is not the worst thing that can occur. So I think we need to really reset our mode and try to see where else and what else we can do. And you'll be surprised that if you try venturing into areas that you haven't ventured before, there is a good possibility that you will actually rebound back surprisingly in other areas.
So your advice, so your advice for them would be to bounce back, right? To bounce back and also to try in a new field, new industry, and new areas.
So don't just keep yourself thinking that I'm only trained to do this. I always wanted to do this particular business. We have to be realistic about it, that some of the businesses are going to take a long time to get back. I reckon within a couple of months, we should be totally back to normal. But before that, what do we do? So look at other options. People are looking at digitalization. If your business can be reformed into a digitalized format, why not try that? So I think the setback is temporary. As a doctor, I can see the disease is actually coming down quite a bit from what we had 2 months ago. Let's hope, God willing, things come back. Meanwhile, try to innovate something.
And the number of cases, according to our DG, Datuk Nur Hisham, the number of cases is going down. So that is a good sign.
Yes. Good sign, not just in Malaysia. You see many parts of the world, the numbers have come down. Of course, there are newer countries where they didn't have this disease earlier. They are beginning to pick up, like South America and some parts of Africa. Well, they will have to go through the cycle. As long as we control our borders correctly, making sure that those countries with the more infected number of patients do not travel across. If they are green zone to green zone, I think they should be able to open up. So I think it's just a matter of time. You just have to be patient, do the right thing, follow SOPs, and if everybody follows it in the correct manner, all of us will be back to normal.
Okay, and for the next question, we are in a PKPP recovery stage from COVID-19. Government offices and businesses have started operating as per usual, and people are allowed to travel to other states in Malaysia. So merentas negeri is allowed. So in your viewpoint, what are the necessary measures that we have to practice during PKPP?
Okay, we must remember the PKP is still on. MCO is still on. Just that now we are in a recovery phase. We should not have this thing in our mind that, oh, COVID is gone, COVID is over, the dangers have gone. No, it's not. The disease, the virus is still out there, just that the number of hosts, in this case, the host would be patients. The number of patients are not that many. But once the number of hosts increase, the COVID will spread back again the way it used to be. So if you look at it in that manner, I think the standard precautions you still have to take, even though you can merentas this, but the SOP of putting up a mask, merentas degree, sorry, di sama-sama. So we just have to make sure that we follow the SOPs. We follow the SOPs. Don't get too relaxed, because when we let our guard down, that's when trouble is going to start all over again. We have achieved
Exactly.
a lot. Let's not destroy what we have achieved.
Exactly, and it's okay if they want to balik kampung, visit their family in Penang, visit their family in Johor, but they have to follow the SOPs. Yeah.
Absolutely. Yes, do that. And that's important. And the most important thing is when you go back to see your parent or to see your elderly, you have to be very careful because the vulnerable group are the elder ones. So we have to be very careful, making sure that we still keep social distance and healthy individuals may be carriers. So we have to be very careful. We meet the vulnerable group.
We have to be extra careful at all times.
Yes. Right.
Okay. Yes. And for the next question, it's important for everyone to take good care of their health and well-being post-COVID-19. What is your tip and advice from a doctor's perspective?
I think the important thing is to keep our immunity up. And the immunity is important that if we keep ourselves well nourished with exercise, just all the normal norms that we have, that can actually prevent a lot of our infective risk. And if you're diabetic, hypertensive, and you have any of these comorbid, make sure you see your doctors often, even though there is a fear of going to the hospital clinic. But get your diabetic hypertension, if you have a kidney problem, checked so that everything is well under control. That's the minimum that you can do in order to prevent disaster should, unfortunately, one gets COVID. Many patients think that I wouldn't want to go to hospital because I might get infected. But the chances of getting an infection in the hospital is not high because most hospitals have got very strict protocol. Patients with COVID, in particular in a government hospital, they don't mix with the normal patients.
Right.
And in private hospitals, it's virtually no COVID because most COVID patients are sent to the government hospitals. So my view is keep yourself healthy, both mentally and physically. Don't take any chances. It's no different like any other time. So if you have a disease, you have a non-communicable disease, as I mentioned to you just now, these things must be taken care of very well to keep yourself protected. That is the important thing that we need to look at.
And we also have to take regular multivitamins and supplements, right, doctor?
Well, the multivitamins and supplements are not proven that it's going to prevent you from getting COVID. It's a myth that goes around thinking that you take all this, you will prevent yourself from getting any sort of infection. It will be good to take, but it doesn't mean that it is preventive. What is most important is you need to take a well-balanced diet. And well-balanced diet with a lot of water, a lot of exercise. These are the simple, basic things that our forefathers used to do, which we fail to do these days. So if you eat food that you cook yourself, which in COVID, I think many of us have done that, and it should be well balanced. I think you don't have to worry about taking supplements and vitamins at a big scale.
Okay.
And that will keep one individual very healthy. Just look at our forefathers and grandfathers. They did very well in their life because they maintained very good health in that manner.
Yes, and I think with good food and regular exercise, that's really important. Yeah, for us to also increase our health and also body immunity system.
Yes, that's important.
Okay, and for the next question, so this is our last question, Datuk. Do you have any other tips and advice that you would like to share with our viewers?
I think the important thing that we learned on the economic side, maybe in the future, all of us should always have alternatives and diversify in our businesses. If you are a sole proprietor, always have something in your mind that you can fall upon should there be a disaster. Never put your eggs all in one basket. Now, we've learned a lot from COVID. Many of us we are very reliant to one kind of industry. You were in tourism, now there's no tourism. You should have always had something different to do.
Yeah, we need
This
a
would
contingency plan. We need a plan B.
exactly.
Yeah.
If you read any books on finance or on investment, you always see this writing written everywhere that always diversify. So I think that's something that we need to learn, that we need to have this in the future. That's number one. And number two, on the healthcare front, those who are in the healthcare business, we should be prepared for pandemics in the future. This COVID has taught us a lot. That many countries, if you see many countries in the world, the hospitals were ill-prepared to face a pandemic like this. Malaysia, we were very lucky. The pandemic did not hit us in a big way, but whichever way it hit us, our Ministry of Health did an excellent job. But moving forward, I think we need to be very prepared in the future. What if the pandemics are bigger than what we have seen this time? So the healthcare sector, if you're managing hospitals, building hospitals, then you must always look at plans where you can convert facilities into managing such kind of pandemics. And thirdly, I think as a nation, I think we need to really collaborate with each other, both in public and private sector, in all disciplines. When it comes to a pandemic, we have to be united.
We need to support each other.
Support each other, not just within the country or even within different countries, because this is looking at mankind, at the human beings. So I think we saw a lot of collaborative work seamlessly done during the time of COVID. We got information from other countries. We worked very well. Whether the country was our enemy or not enemy, we all worked together for the mankind. Countries who had the know-how in vaccines immediately started producing vaccines. We started giving them data, information, and vice versa in all other areas. And I think that collaborative work, partnership, and the synergy that we had essentially was very important. So I think we need to adapt this in the future in our life. You must have this networking in order for us to fight such kind of pandemics or such kind of disaster in the future. I must say COVID may be bad for many of us, but COVID has taught us a lot. We are probably better than what we were before COVID in many aspects. Those who are suffering because of the economic sense, don't worry, there's always a silver lining for everything.
Yes, and I agree with you, Datuk. There's always a silver lining, and there's a lot of lesson that we can learn from this pandemic. And it also teaches us to always, we never know what's going to happen in the future, so we have to be prepared. Yes, and I like what you said just now. Like you can't have you need to have diversified, like for example, you need to do something like an option B or option C, like you need to have a contingency plan laid out. So just in case if something happened, okay, things happen, okay, COVID-19 happened, okay, what can we do? So for example, we have digital media, digital marketing, we have the internet to help us, and there's so many things that we can do online. So we have to shift online, and we also have to diversify. Yes.
I think the important thing to the younger ones, it's always good to learn different skills. You may have your mainstream professional job or mainstream work that you do, but you should always have, if it's a hobby or if it's something that you like to do, just be good in something else, because you can never know. You can never know. Don't just focus in one.
Yeah.
Yes. So if you are a good entrepreneur, or you may be good in business, why not you pick up music and be a singer as a part-time hobby? But you can always go online and go into that kind of a thing whereby you can help. If you're doing something with nothing to do with digitalization, why not you learn digital technology, because digital technology can help at this point of time. So there are a lot of things that we can diversify, and I think that's the way we should work in the future.
Okay, thank you so much, Datuk Kuljit Singh, for the sharing session today. And thank you for providing us with your tips and your advice for us to stay positive and always move forward, right? Okay, until then, stay safe, take care. Thank you, Datuk. Bye.
Thank you. Bye bye.